am sitting here with the patriarch of Harris Dental, Dr. Joe Harris. You have just got to stand back and marvel at the strides that you've made since you opened in 1979 to now.
It has been a journey, because when you graduate from dental school, you know what you know. But dentistry has changed so much. There have been one thing after another, both in terms of technology, but also technique. And it's an exciting place to be. And then to be able to work with my family, that really is the biggest difference for me.
I've talked to your sons. No fights, no arguments. They're not lazy, hanging out in the back room, and you've got to get on their case.
You know, it is an interesting part of our family. They don't fight. They didn't fight as kids, so no, we get along great, and it is a special thing for us.
Not to get cheesy, but do you ever get a little emotional when you walk by and you see one of your sons with a patient, and you see the way they're treating the patient, because they have both said they learned from you how to treat people the right way? Do you ever get a little emotional watching that?
Yeah.
Are you going to start crying
now?
No,
I absolutely do get emotional. I consider it a flaw almost, but of course I do.
I think you may have cried when you did my teeth, actually. Because I came in, it was bad. It was bad. What did you think of the work that you had to do on me? Because I know I'm not the only one that has had veneers. The Invisalign, I know I'm not the only one that has dealt with the Invisalign. What is that experience like for most people?
People come from so many different places. You know, you had some little things, really, little things, compared to what a lot of people deal with. And we just try to meet that person where they are. Some people have problems you couldn't even imagine. And to be able to find out what it is they want, where it is they'd like to be, is a lot of fun. That's part of why we come to work.
I know you do some charity trips as well, where you go into these third world areas, and I would assume that's the most extreme you can get. So whether it's something like that or a patient here that has a lot to work with, talk a little bit about that journey with them, because you've got to come away from that experience. It's not just, oh, I made them look better. It's kind of an emotional investment in some of this.
When we go to other countries and work with the poorest of the poor, it's always so humbling for me, because when we come home and realize where we live, what we have, and what they don't have, it makes you want to go back.
Yeah.
Makes you have to go back. But it is on a different level. Of course, they're not into, well, I've got to say this, they do care how they look. When we go to Dominican Republic, which has sugar cane as a local product, those kids grow up with sugar between their teeth. And so many of them are losing their front teeth. And so that's a big part of it, to give them their self-esteem back. But dentistry is teeth, but it's also about a lot more.
That's a great point. I talked to your sons about what they've learned from you. What have you learned from them? You know, kids are usually better with technology anyway. Have you learned some things from them?
No, I've learned so much from them. We used to kind of joke about it and say, I'd like for them to start where I left off. In other words, if I got to a certain point, I'd like that to be their starting point. And in a way, it's been that way. I'm very proud of them. I won't brag on them right now, but they do a lot of really good things, and they'll go a lot farther than I have.
How hard is it for you as you continue to expand? You know, you're known for this great, warm, intimate family vibe, but you keep adding new locations. How hard is it for you all to keep that intimacy, but yet continue to grow?
Part of the reason we did it is because we got too busy here. To be honest, it didn't feel like it used to, and we needed more space. And we have patients that travel from all over, so by expanding, it makes it more convenient for them, number one. Number two, we were really, really pleasantly surprised as we brought a couple new people in to what we're doing. We found exceptional people, and our patients love them. And they just fit right in. We're really pleased.
Well, and the other nice thing is, not only have I, gotten to know all of you guys, your whole hygiene staff, I've dealt with all of them. And that's one of the things I want to make clear. I've lived in the Valley for, I think, 16, 17 years now. I've only known you for maybe 2 of those. I've had other nice dentists, but I would skip out on my appointments. I would come up with any excuse to not have to fix what I ultimately knew I needed to fix, specifically one of my front teeth. But for some reason, coming in here, I've not missed one appointment. I'm always on time, which is rare. I've fallen asleep in the chair. I'm completely distracted when you've got the drill thing over me. And I went through the whole process of the months of the trays and things that I normally would have been lazy about. Why is that? I say it's exactly what you've just described.
Yeah, we look for the right people, because there's a difference between going to work and going to something that you appreciate and that you like doing. And we feel like we make a difference. Every one of those hygienists is committed to that. So I'm a little embarrassed with all this talking about it, but
come on,
but
brag,
it's
Dr.
true.
Harris. Let's do this. I have to tell you, I don't normally do this. I don't think I've really done any work in terms of helping promote a business. You know, we always had to stay very impartial working on television, but this is so easy for me to do and talk about. And by the way, they've been thanking me all day long for helping them, and I feel like they've done such wonders with my teeth that it's the least that I can do. So I think it's okay to brag just a little bit. What is the most exciting bit of technology out there now that you're seeing, that you're really excited about?
Wow, there are a lot of things going on right now. Dental implants are at a place where they've never been, where people who literally don't have any teeth can have a mouthful of fully functioning teeth. They can eat steak.
Gosh.
They can eat apples and raw vegetables without pain, without teeth popping out, that sort of thing. So it's across the board. The CAD/CAM technology, where we make teeth while you sit and wait and have them be every bit as good as anything we've ever done. The science behind all the periodontal things we do with gum health is better than it's ever been. And there's things on the horizon with stem cell research, things like that. Dentistry is a great place to be.
Isn't it amazing when you look back at 1979 when you started this, all the things that are available now that were not available then? I mean, I wonder how folks even managed.
Well, if you think about what the rest of the world was like, cassette tapes. You don't even remember 8-track tapes.
I've heard about
yeah,
them. No, I've seen them.
But things in general. I mean, I remember my first brick phone. So the world is changing rapidly, and our goal and our joy is staying right at the edge of it, because there's a lot of cool stuff happening.
Listen, I love your sons, but if you ever retire, so help me, I will track you down and I will find you.
Why would I retire?
I don't know. I hope you don't.
No.
I really encourage you to give Harris Dental a call. They do free consultations. As you can see, you know, it's nice to see you kind of loosen up a little bit, because I know you try to be professional and it's not every day where you have lights and cameras in your face. But I can't thank you all enough for what you did. I might get choked up for what you did with my teeth. It was a long process. A lot of times people approach you, and being on television, they don't even know you have issues because they don't see you up close. But I had a few. I know you called them minor. I considered them major, and I just smile even bigger than I did before now that Dr. Harris and his team have gotten a hold of me.